Good afternoon, everyone. Thanks for joining today. And I will go ahead and get started with the presentation. So today we're going to talk about EPSDT screening, diagnostic, and treatment, and other services that children or members 0 to 21 can receive if they qualify medically to receive those services. So next slide, please. This is just a disclaimer, and Shoshana read that. Okay. So the goal for EPSDT is to assure that individual children get the health care that they need when they need it. They need to get the right care at the right time in the right setting. So through Medicaid's EPSDT program, children under 21 are entitled to all medically necessary services. And we'll talk more about that as we go, medically necessary. They're entitled to receive all the equipment that is medically necessary, regardless of whether these services are provided under our state plan, if they're approved by the federal government, and if they impose on coverage for, if the states may impose on adults. If we cover for adults, we'll cover for the children. I'm sorry. Next slide, please. So the Social Security Act with 1905 is where it all started, with the law that passed to mandatory services, screening services for children medically necessary, so that they would be able to diagnose and treat any problems that they may have had or identify any problems. So EPSDT does provide a broad array of preventative, diagnostic, and treatment services that are comprehensive in nature and high quality for low income. We have programs for infants, children, and adolescents under 21 as specified in the Act. The program for children is always a little bit more robust than adults. This program has been around for years and years, EPSDT, very little change in the regulations over the years, but it's definitely grown as far as helping providers to make sure we get everything done for the children. The program enables states to design a health benefit that meets the specific needs of children served by its Medicaid population. We use the Bright Start periodicity table, and if you provide services for children, I'm sure you're aware of that. If not, it is in the slides, and it will be shared at the end, some of the resources that we go over. While children enrolled in Medicaid are entitled to a broad scope of treatment services, no such services covered under the Medicaid unless it's medical necessary for that particular child. Services are very individualized. If it's medically necessary, that's a big thing, and it's not experimental or investigational, usually the services are covered. Now, if it's not written out, maybe it needs to go through a little bit further process to be covered, but I encourage families especially to seek the care that their child needs. Next slide, please. So, of course, services that we provide don't need to correct or fix a condition. It can't cure the condition always. As long as it contains or current health condition, the services can be covered because they are considered to ameliorate the condition, which makes it not get worse, just to stay even. Now, of course, our goal always is to improve, but that's not always possible for every given condition that a child may have. Maintenance services are defined as services that sustain or support rather than those that improve or cure or improve the health. Next slide, please. So when we talk about EPSDT, it's a very broad scope of services that children can receive. On this slide, it lists quite a few. Not all are provided necessarily, like, for instance, school-based services aren't provided by AmeriHealth, but they are provided by school-based clinics. They're, skilled nursing, although it is approved through us, it's done by home health companies. All the services are different that are available out there for children, infants, and such. And I'm going to go through the ones that I thought would really be helpful for you all to see and talk about. But if you have any of these services that you want to talk about more, if you just ask me, I'll do the best I can. If I don't have the answer, I'll definitely get you the answer. Next slide. All right, some interesting facts. Even if a service is not on Medicaid, as I said before, it is still be covered if permitted by the federal law, Medicaid law, and is necessary to correct or ameliorate the physical or mental condition of an enrollee who is under 21. Again, it can't be investigational and it can't be experimental, but those services covered. And fees that have no equally effective, more conservative, and less costly options available or suitable for the enrollee are covered. So in other words, if there's something that is going to lean to the less costly, service options out there, but if they're not available out there and we have to go with the higher cost, then that's what we have to do. And with children, especially our sick babies, you'll see a lot of them, we pay for them to go to other states for treatment and such, because that's where they can get the best care. Of course, non-FDA, and as I said, experimental or investigation or cosmetic are excluded from Medicaid and will be deemed not medically necessary. It's interesting to know that there's no fixed limits on the amount of services beneficiaries can receive. For instance, for the PCS services, some children receive 2 hours a day, some children receive 8 hours a day. It's very individually, prescribed for that child. Medicaid office services more comprehensive. If Medicaid office services that are more comprehensive than services offered through schools as part of the IEP. IEP covers services with a child's education. Medicaid outside the IEP process can cover other aspects of a child's life. So for instance, often children may receive, for instance, physical therapy. It depends on if a physical therapist in school has a goal for that child and there's a total different goal that the child needs to meet at home needs, then they might receive outpatient as well as children receiving services in the school system. So again, it just depends on the individual child and what the services are being prescribed for. Of course, some of our programs and some of our services will need prior authorization, and if you don't know about which ones they are, we can surely discuss that. Next slide. All right. So the first thing I'm going to talk about a little bit is support coordination. We talk about it as case management, and there's today out there so many different levels of case management. Next slide, please. This program was established as a result of a lawsuit, Chisholm versus LDH, to provide support coordination or case management to individuals who had disabilities or chronic health conditions. Chisholm class members, which children are still qualifying to be Chisholm class members, are children under the age of 21 who currently receive or are eligible for Medicaid, who are on the Developmental Disabilities Request for Service Registry. So if you have a child that comes in that meets the criteria for developmental disability, there's a registry that they can go on with our state, and then if they're under 21, they'll qualify for Chisholm. Legacy Medicaid are services Medicaid for people enrolled in a managed care organization. Chisholm class members have the option of staying with Legacy or for their physical health or choosing an MCO. And you'll see that's the same for children that receive some of the waivers in our state, especially like the NOW waiver. If anyone receives that, you'll see that they're eligible to stay with fee-for-service or go with an MCO for their care. Some Medicaid enrollees only receive specialized behavioral health services and transportation through the MCO. So some of your members, you may see that they qualify for Medicaid, but we only provide those two parts of their Medicaid plan, and the rest is done through Legacy Medicaid. Any questions? All right, next slide. So what is the support coordinator's role? Our case manager's role are to educate regarding the services available to them, suggest appropriate evaluations, they determine the service. They should assist the enrollees with finding and securing and accessing medical necessary supports and services. They support the enrollee and their parents in their decisions. They follow through with service requests, ensure services are provided as authorized. I would say to parents and to you guys, if you have parents that are struggling, especially with trying to, schedule everything, get everything coordinated, to see if they qualify for support coordination or case management. It's a service that's provided through, if they're on the DD waiver or if they're in the DD register, developmental disability register, they can receive those services, and it is a big help for a lot of our families. So that's something that you can always have out there for them. Next slide, please. Does anybody have any questions about support coordination or case management? I'm going to talk a little bit about physical therapy, occupational and speech therapy, and probably most providers are aware that these services are available to children. They must be ordered by a physician and they must be prior authorized. School-based therapy is for ages 3 to 21 and early steps 0 to 3. Services such as physical and occupational therapy are covered if they have a maintenance purpose, like we talked about earlier. They may not correct or cure, but they may prevent contractors from getting any worse if children have contractions and things like that. Any questions about that? Therapy services are pretty straightforward. The interesting thing I will say is in this CMS EPS guide for states, you'll see a lot of services that people don't think about. For instance, a lot of children do better and more therapy is just going to a brick and mortar building to get their physical therapy and such. And so there are options out there, and families and providers need to seek out what works best for their individual child or member or enrollee. Next slide. I'm going to have Renee Wells, she's another nurse at AmeriHealth, talk to us a little bit about the dental services.
All right, I think we need to go to the next slide.
I'm sorry.
That's okay. All right. All right, so why are dental services important in regards to a PCP? So dental disease in children is preventable, but once it sets in, the disease can affect a child's physical development in the form of reduced body weight and interference with growth. It can also affect a child's school attendance and academic performance to significant implications for a child's social development and future success. So the American Academy of Pediatrics recommends that a child's first dental visit occur as soon as the first tooth erupts, which is usually between the ages of 6 and 12 months of age. Early examination, intervention, guidance, and referrals can prevent future costly and painful dental diseases, including cavities. Cavities are the most common chronic disease of childhood in the United States. And so the good news is that cavities are preventable. Next slide, please. So fluoride varnish. Fluoride varnish application should be applied to children's teeth starting at the age of 6 months to 1 year. It is covered twice a year to be done as long as it's billed at least 6 months and 1 day apart. Providers do need a certification in order to bill for that service, which is Smiles for Life. It's the number 6 course and pass the post-course assessment. It takes an hour to complete, and you can go to smilesforlifeoralhealth.org to complete that assessment and complete the course, and then you can immediately start billing for reimbursement. So it is recommended that this application, along with anticipatory guidance, be provided to children at high risk for dental caries. It is reimbursable if done during a wellness visit, but it cannot be scheduled or done as a standalone service. And the intent of providing these services in the physician's office is to improve the overall health of Louisiana children while potentially decreasing future costs of untreated dental diseases. And I will hand it back over to Michelle.
sorry, I was trying to go for me. Does anyone have any questions about dental services? All right, next slide, please. This service is something that a lot of families do use now more than they used to. Years ago, it was very limited to the scope of what, it's still limited in the scope, but you'll see that it's there's a lot more children using this service than they did years ago under EPSDT. So personal care services are provided to children under EPSDT if they medically qualify for them. It's basic personal care, toileting, and grooming activities. The personal care services can be to help bladder or bowel requirements or problems. They cannot do medical tasks, which you'll see down here. That's more, for instance, they can't catheterize the child, but if they wear diapers or they need reminders or need assistance to the bathroom, they can do those things, but they can't do any medical tasks. They assist with eating and food preparation for the child. That's something that we do have to remind parents sometimes, that they're not there to cook for the whole family, but they can prepare the child's food. Performance of incidental household chores only for the recipient. And again, the easiest thing I can say is going back, let's say the child takes a nap and wakes up and wet the bed, then yes, they should change those sheets and, make that back, they can wash those sheets, but they're not to wash the whole household clothes and stuff. Accompany children, but they can't transport them to medical appointments. The problem, of course, the transportation is an important part and the reason why some of our children aren't able to get care today. So unfortunately, PCS does cover transportation, but it's for the parent. Next slide, please. So personal care services must be prior authorized. They must be medically necessary. A practitioner must complete an EPSDT PCS Form 90 to prescribe or refer the services and to sign the provider's plan of care. So when a child, if you're at your office feels like, okay, this family could really use these services, the best place for them to start to get all the paperwork and stuff going is if the provider would write, and I wouldn't specify a number of hours at this point, services, then they have a choice, freedom of choice of providers. So would choose a provider, and that provider would help them. If not a support coordinator didn't qualify, that the provider could help them to get, because they have to have a social assessment, they have to have a schedule for what hours they'll use it. They can, some PCS services now can be done while they're at school, depending on what, again, it's all medically necessary and for the right reason at the right time for the right child. They'll also request when they're submitting their whole packet is a prescription for the physician, from the physician or provider, basically saying PCS services for 4 hours per day, 7 days a week, something like that, you'll see. All PA requests should include necessary documentation to support the medical necessity of the request. Next slide, please. Does anybody have any questions about her services? All right, we're going to move on to PDHC, or Pediatric Day Health Care. That's something that probably has been around now for about 12 years, I would say, 10 to 12 years. It's a program in which children that have greater needs that require a nurse that have a skilled nursing need. It's a facility that provides therapy, education, personal care, and nursing all at one time. So if they qualify for all those things. But go to the next slide. So a Pediatric Day Health Care Center, PDHC, is a pediatric day care for medically fragile children under the age of 21. It can be provided up to 7 days a week and can be provided up to 12 hours a day. Now, of course, most facilities, some of them are open 12 hours a day. Not all of them open 7 days a week, but some of them do open 7 days a week. It provides an alternative in-home nursing care. So, and I'll talk about that in a little bit. I think extended home health or extended nursing care for children, which is something, especially children on vents, trachs, things like that. You'll see that they have a nurse that comes in their home several hours a day. So this is, it was done years back when they wanted children to have more interaction with other children and be out of the home sometimes. Well, this is a way to get them out, and it's been a pretty successful program. It does require physicians' authorization. They need to order those services. They're responsible to sign off on the plan of care and approve the plan of care that the facility develops, and collaborate and consult with the PDHC on all the services that they do receive at that center. The physician maintains the responsibility for the child's overall medical management. These facilities do have a medical director, but that medical director does not usually treat the children. They oversee the facility. That makes sense, hopefully. Next slide. All right. So what can they get out of PDHC? It's an individualized plan of care. Like I said, it's nursing care is the number one thing that they usually need. Respiratory care, physical therapy, speech therapy, occupational therapy. They can get assistance with activities of daily living. They provide transportation to and from the daycare. They provide psychosocial activities for the children. They are responsible for meals most of the time and educational services. What does not cover is before and after school care, medical supplies or appliances. So each child pretty much brings in their own equipment. Any kind of formula for feedings, if they're parental or enteral. Infant food or formula is not covered. Prescribed medications that need to be supplied by the family, and duplication of services already provided in early steps. So some of these children get early steps in their home, and early steps could include physical therapy, occupational therapy, speech therapy. If they're getting that already at home, then it should be received at the center as well. Any questions about that? Next slide, please. All right, so they are licensed facilities by Medicaid. They must request prior authorization. The hours of services are documented in the plan of care, and they're usually staffed by RNs, LPNs, and direct care staff. Next slide. Excuse me. So extended home health or skilled nursing, and this is what I was talking about as far as nursing in the home. It provides in-home skilled nursing care to enrollees that are under 21 years old that are medically fragile. The care is done by a registered nurse or an LPN. Of course, the services need to be medically necessary and ordered by a physician. They can be intermittent or part-time. As we all know, most of the time, home health is you go in and you're there to complete a skill, whether it be wound care or maybe an IV administration, and then you leave. With extended skilled nursing, usually the nurses are in the home for 3 or more hours in a day. If it is more than 3 hours, that's when it needs to be prior authorized, certifying that they need a home health plan of care. If they require less than 3 hours, those services prescribed by a doctor do not need to obtain prior authorization. However, these services are subject to post-payment review. So I always recommend that facilities get prior authorization if they can. Services are not limited in frequency or duration, but on an individual needs basis. So again, as we talked about with PCS services, some children may need 2 hours a day. Some children may need 5 hours a day by a nurse. Other children may need 3 hours by a nurse and 6 hours PCS. The whole thing is they can't overlap those services. You can't have a nurse in there at the same time you have a personal care attendant or personal care services in the home. Services must be administered in the enrollee's residential setting. The nurse is allowed to accompany the enrollee for medical visits, such as doctor's appointments or emergency room visits, and these services cannot be done out of state. Whereas PCS services with prior approval through the state, the personal care attendant can travel with the families in some instances. Any questions? Next slide, please. So other extended home health services, rehab services including PT, OT, ST, audiological services if deemed medically necessary. Services need to be medically necessary and ordered by a physician. They need to be prior authorized. The enrollee will be authorized for only 6 weeks of extended home health services at a time. This is to ensure the signed POC is on file. Prior to the end of 6 weeks, prior authorization period, all the requested information, including the signed POC, must be submitted to extend the authorization. So we know that they're not going to have a plan of care when they're doing home health or extended home health services on the day they start the services. So we only authorize it for the first 6 weeks, and by that time, they should have a good plan of care and know exactly how much time is needed. And another thing with all these services, we always have to remember we can't order these services because a mother has to work. That's not a medically necessary reason for a child to receive these services. However, a mother doesn't have to work for this child to receive these services either. I mean, the mother could be home and may have, other children. They have their own, they have household things, have other things going on, and some children require, a lot more attention or ongoing care that the mother can't do all by themselves sometimes. Next slide, please. Medically necessary. So what is medically necessary? Those are defined as those health services that are in accordance with generally accepted evidence-based medical standards, or that are considered by most physicians or other independent licensed practitioners within the community of their respective professional organization to be standard of care. And all of us working in physician's office or with providers definitely understand what medically necessary is. And then medically fragile means individuals who have a medical complex condition characterized by multiple significant medical problems that require extended care. Medical fragile problems include, but are not limited to, severe lung disease requiring oxygen, severe lung disease requiring ventilator or trach care, complicated spina bifida, heart disease, malignancies, asthmatic exacerbations, cystic fibrosis, neuromuscular diseases, encephalopathies, and seizure disorders. These are the children with these diagnoses that you'll often see getting extended home care or nursing care in their home. Any questions? Next slide. Transportation. So transportation has to be provided in all parishes to all eligible beneficiaries. If there's a need for special arrangements such as a lift, or sometimes people need to be transferred in an ambulance, then the MCO must ensure that such arrangements are made properly so that the enrollee can obtain the medical services they need. Most of the time we request that requests for transportation, we ask for 48 hours advance notice if at all. I've seen on occasion that we could do it, but usually you need at least 48 hours because, of course, that's a service we contract out with another provider to provide. Children under 17 must be accompanied by an attendant. Now, the PCA can use the transportation that we provide. They can take the child to the doctor, so can the nurse, but usually most physicians' offices want the parent there as well. So 2 people can't transport with the child usually. So that's something that the family would have to work out. Non-emergency medical transportation is provided for Medicaid enrollees and to and from a provider and a Medicaid service and any other Medicaid service, such as like the therapy. They would provide services. They'd provide transportation there. And again, 48 hours in advance is what we try to get. Next slide. All right, school-based services. According to the Centers for Medicaid and Medicare, research has shown that school-based services for Medicaid enrollees is a growing resource that can help children get the care that they need. I think in Louisiana we have 60 school-based facilities now, which means they have a provider that either comes to the facility on a regular basis, and they can, the children can receive some of the services such as their wellness visits, if they have sports physicals, if they have, something that, they not feeling well or something, sometimes those providers can provide that care. Recognizing the strong link between quality healthcare and quality education, school-based healthcare can help decrease disparities in care for some of our most vulnerable children. And as we know, a lot of our children do live in areas that have a lot of providers. And so having providers go to the schools definitely will help some of those disparities, and hopefully those children will get care through their schools. Next slide. Louisiana Department of Health requires this statement to be provided to all parents of students receiving services. Your child is eligible to receive services to meet his or her needs. The services may be provided at the school system, or you may take your child to another provider that accepts Medicaid. This is required for the state to meet the CMS freedom of choice. So there's always been a freedom of choice for providers, and so we don't want to make it that children have to receive the school-based services. They can, a mother or caregiver or guardian can, I don't want to receive services. I'm going to take them to the doctor myself, and that's totally acceptable by everyone. Next slide, please. So to be eligible for school-based services, the child must be enrolled in Medicaid on the date the services were performed. So they can bill for Medicaid, but they have to be enrolled in Medicaid. Have a medical or behavioral health diagnosis, have a plan of care that the diagnosis and specific services required, specifies services that are required. So in other words, when we're talking about school-based services, we're not only talking about medical services, we're talking about physical therapy, speech therapy, occupational therapy, adaptive physical education. All those things are in the plan of care, or what we call the IEP, individual education plan at school. The provider of services must be licensed, enrolled Medicaid provider, list providers allowed to provide services, and they have to have written parental consent to bill Medicaid. So in other words, there's a whole different way of billing that school systems do than what providers do, basically because schools already receive some federal money for some of these services. So it's a whole different way of billing and stuff that they do. Now, some school-based centers do have private providers that go in and hold clinics. And those providers then bill under their provider ID and bill as a provider visit. So that's something that some providers do in some of our schools as well. Next slide, please. So the school-based programs that fall under EPSDT include nursing, health services, students with a written plan of care requiring medication, distributions of any medication while they're at school, respiratory therapy, optometry services, and implementation of doctor's orders. For all students, whether they have a written plan of care or not, they are eligible, if they have Medicaid, to receive health evaluations, hearing and vision screenings, medical evaluations to determine if further treatment is required, and annual immunization checks and vaccination counseling. Any questions? Next slide. School-based therapies include audiology, hearing evaluations, speech therapy evaluations and therapy services, occupational therapy evaluations and therapy services, physical therapy, the same, behavioral health services. They provide evaluation and treatment and applied behavior analysis services, personal care services, and special transportation services. Next slide. So just to kind of recap some of it, the parent must consent for Medicaid enrollees that receive IDEA, individuals with disability status. The parent can withdraw consent at any time. A student is allowed to have services both at school and a private provider. Schools bill Medicaid has no impact on the enrollee's ability to receive other services. School-based services do not cost Medicaid enrollees anything, and does not cost Medicaid. Okay, and school and private providers bill two different entities, two different things, as I said. Next. So DME, durable medical equipment and medical supplies. Next slide. For participants under 21, they can obtain any medically necessary medical supplies, equipment, and appliances needed to correct, improve, or assist in dealing with physical or mental conditions. This includes lifts and other devices to help families deal with a child's circumstances, such as communication devices, and also some medically necessary dietary or nutritional assistance. Medical equipment and supplies must be prescribed by a physician. Once prescribed, the supplier of the equipment or supplies must request approval from Medicaid, since this is a prior authorized service. Diapers, pull-ons, and liner guards are for individuals age 4 through age 21 if they have a medical condition resulting in bladder or bowel incontinence and meet other LDH criteria. So under 4, we don't cover them, as they feel like that's something that all children may need, but over 4 we do cover them. A prescription request form for disposable incontinence products may be completed, or a physician prescription along with the required documentation can be submitted, and that's the website that they submit to. Next slide, please. So another service that's provided is language access, cultural appropriate services, and provider service information. Of course, as Medicaid provider, we do provide translation assistance for all of our members, and there's a number for translation assistance. Multicultural health information is available at our website, and that gives you some information there. Our handbooks and website is available in multiple languages. AmeriHealthcare's Hospice of Louisiana provider services can be reached at this number Monday through Friday, or actually every day. Call sheets after business hours on weekends and holidays are answered by off-hours team. So we have somebody on call pretty much all the time, but it's not going to be our regular staff that, of course, answers the phone. We do have a nurse's line that can be reached, and a medical director is also on call to address any medical necessity determination requests that come through after hours. Any questions? Well, I think that's the end of my presentation. Next slide. And I will open for any questions I may have.